Hey, Dr. Jerry Williams with Urgent Care 24/7. I'm here to talk to you today about a common problem we see in our National Urgent Care Company. We see people with complications from body piercings, and that means body piercings of all types: earrings, nose rings, facial, brow, lip, all kinds of different piercings. And I want to talk to you about those because it's a very common problem. So you have to understand that when you have a piercing, you're actually putting a foreign body into your skin, and it's a wound until the wounded area actually epithelializes or skin grows over that open wound. So during that period of time, from when the piercing is placed to when it actually grows over with epithelium and the skin is contiguous along the canal of where the piercing is, that open wound is subject or more prone to infection. So that's why when you get a piercing, they tell you to wash it with soap and water, keep it clean, and also to rotate it so it will not the actual earring itself or the actual piercing itself will not adhere to the wound and allow that epithelialization or skin growth to occur inside the canal of the piercing. So we see patients who, even if you do all that stuff and you're careful about it, it can still get infected. But unfortunately, when people have new piercings, they tend to fidget with it and play with it. And it's a natural response because it's new and your body's trying to get used to that feeling of that foreign body there. Plus, your body's trying to get rid of it. It's saying, hey, there's a foreign body or foreign object here. We want to reject that foreign body. We want to get rid of it. So it makes perfect sense that people are more apt to put their hands on it, dirty hands touching the wound, and thus can lead to an infection. And this is really common. So when we see these patients, of course, the first thing we want to do is make certain that we get the infection under control and get it completely cleared up, because these infections can lead to cellulitis, abscess, and even systemic sepsis, where the bacteria go throughout the entire body, and that can be a life-threatening illness. And we don't want that to happen. What's interesting, though, is we also want for our patient to not have to go through a piercing again. We like to try to save the piercing and not have to remove it, and where the patient has to start all over, where the wound has to heal over completely, and then they have to go back after all that's resolved and try again and get another piercing. So we try to save or keep the piercing in place if possible. But at least half the time, if not more, infections are serious enough to where we feel like we have to remove that foreign body and do careful wound management, wound care until it heals completely, and then send the client back and try again. So in these cases where if you're going to get a piercing, you're thinking about getting a piercing, it's really important that you prevent that infection with keeping your hands off of it, very, very careful care after your piercing, and of course, first and foremost, going to a reputable piercing professional who will use aseptic technique and make sure that the procedure is done in an aseptic or sterile under sterile conditions, so you don't start off with it being prone to an infection from the beginning. So make sure that you listen to your piercing professional's advice, follow it to the letter, keep your hands off of your piercings, and if you see any evidence of unusual discharge or pus, any extraordinary or increasing redness or swelling, pain or any fever, or any there would be a hot feeling around the piercing to the touch, you need to go seek medical care immediately for that and get it evaluated, because you could be starting infection. And keep in mind, the earlier we catch that infection, the less severe we catch that infection, the less likelihood that you're going to have more complications, and actually the better the likelihood that you might be able to save the piercing and not have to remove it completely, though in more cases than not, we do end up having to remove the piercing. We hate that. We want to try to save that, but your overall health and well-being is more important than the piercing, of course. So I hope that you find this information useful. And if you get a piercing, I hope that it goes smoothly and you get a fast healing and you can enjoy that piercing for a long time, and we keep your complications to a minimum. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.